On the 27th of February 2020, the Nigerian government confirmed the first case of coronavirus in Nigeria, being the first case in the country since the outbreak of the disease in China late 2019. Taking you down memory lane, the case was an Italian citizen who works in Nigeria and returned then from Milan, Italy to Nigeria's commercial city of Lagos on the 25th of February 2020. He was confirmed by the virology laboratory of the Lagos University Teaching Hospital, part of the laboratory network of the Nigeria Center for Disease Control. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure that an outbreak in Nigeria is controlled and contained quickly. The multi-sectoral coronavirus preparedness group, led by the Nigeria Center for Disease Control, NCDC, immediately activated a National Emergency Operations Center to work closely with the Lagos State Health Authorities to respond to this case and implement firm control measures. Also, a presidential task force was established, presided over by Secretary to the Government of the Federation, Boss Mustafa, to champion the sensitization of Nigerians and create necessary awareness on the dreaded disease and the federal government's efforts at curtailing it. It has been 2 years down the lane, and the Nigerian government has not relented in its efforts to contain the disease. This is our focus on Nigeria today, as we reflect on 2 years of managing COVID-19 pandemic in Nigeria. I am Lydia Ochi. Welcome to the program. With me in the studio to join in the conversation is Professor Abdul Salami Nasidi, former Director General, Nigeria Center for Disease Control, and member ministerial experts on COVID-19. Thank you for joining us.
Thank you. Good evening.
I also have joining me via Zoom Dr. Rilwanu Mohammed, Chairman, Bauchi State Primary Healthcare Development Agency, Chairman, Surveillance and Contact Tracing, Bauchi State COVID-19 Response. Thank you for joining us.
Good evening, viewers. You're welcome.
Also joining via Zoom is Dr. Olaolu Aderinola, Deputy Director and First Incident Manager of the National COVID-19 Emergency Operations Center, Nigeria Center for Disease Control. Thank you for being a part of the program.
Good evening. Thank you for having me.
Excellent. Before we continue, let me take you through or down memory lane with this report. Okay, that report will come later, so let me go straight to our conversations. Prof, how would you describe the situation for the past 2 years?
We should say on self-assessment, definitely we give ourselves high marks. We've done well in many places, places that we had some minor diseases, but nevertheless, on the global platform, I think Nigeria should be rated as a country that have performed very well in response to COVID, and that even taught the world, some response mechanisms, how to fight such epidemics and pandemics. Okay. So the situation is not as bad as some people might be thinking.
Okay, now let me ask Dr. Rilwanu Mohammed. Nigeria was categorized as one of the 13 high-risk African countries with respect to the spread of COVID-19. What is your assessment of the situation 2 years on?
I must say that the steering committee, the Nigerian government, the commitment of the president, the commitment of the governors, you can never imagine that people say that when the coronavirus reached this country, many people have died. 10 million people. So people say 10 million will die in Africa. You see death on the street. Thank God when we came in. Thank God when this virus came in, a lot of activity were gone. Many strategic leaders got infected. The control became very serious. The government and all the partners came together, and we are seeing in Bauchi State, out of the 2 years, only 24 people died. they expected that more will die, but because with the intervention, the NCDC did very well, the MPNC did very well. I think by and large, the expectation of many people who have got infected and died has come to pass, and we are now in the second stage of the pandemic.
Let me go over to Dr. Olaolu. The weak health care system in Nigeria was made more pronounced during that period, making the country highly vulnerable among other African nations. Would you say the situation in the health sector has improved in the past 2 years?
Well, I think COVID-19, what it has done, it has really opened our eyes to the deficiencies that we have in the health system. And by and large, what has helped us that we were able to respond the way we did, because we did some preparedness activities were on ground before COVID-19 struck, and we were able to mobilize all our various stakeholders at the state level, our partners, and we had strong leadership from the government leading the whole of society to respond to this. Still, we know there are still gaps within our health system, and COVID-19 has opened those, revealed those gaps for everyone to see. So we need to really build on those gaps that we have so that we can improve our health security. We know now that any disease anywhere can get to any part of the world at any point in time. So as the global international community wasn't as prepared as expected for this, despite preparing for pandemic influenza, it shows that we are all not prepared. But for us as a country, we need to do a lot more to improve our health security, improve our health system. But by and large, we did all that we could, and we also want to thank Nigerians for being persistent and bearing through all these trying times of the physical isolation and all those things that we need to do. By and large, we still have a big room for improvement, but by and large, we did quite well with the resources that we have at our disposal.
Professor Nasidi, several persons insist that the lockdown witnessed in Nigeria was child's play, arguing that the lockdown should have been more serious, like we saw in Australia. How would you describe the level of containment that Nigeria had witnessed in the last 2 years?
Well, definitely, we had lots and lots of weak points in our lockdown system. First and foremost, it came late, a little bit, later than we thought it would be imposed. And the second weakness is that the handling of the informal sector, workforce. Mm-hmm. We all know that the informal sector is responsible for about 65% of our GDP and actually employs 90% of the workforce. And these are the people that must must come out to eat. That is, they are not employed and paid salaries. Mm-hmm. If they don't come out to work that day, they will not be able to eat. And the lockdown came, don't come out, don't move. And, it was not really... no compensatory measures were put in place to take care of this informal group. So that was a big weak point, but nevertheless we succeeded in containing the virus, not at the speed that we would have loved. Unfortunately, the virus ran away from us. It was ahead of us because of that weak point. For instance, after the Italian was diagnosed, coming from Europe, flights were still coming from Italy, and so many other things. So both border control measures and the lockdown had some lapses, no doubt about it. Right. But we tried.
Okay, Dr. Olaolu, by your assessment, would you say Nigeria handled the issues of COVID-19 well enough? That's assessing the initial situation, contact tracing, enforcement of non-pharmaceutical protocols, and the lockdown.
Well, I'll just say that looking at where we were before and where we are now, we improved on our responses. We know that when we had the first case of COVID-19 in the country, there were only 4 laboratories that could test. We didn't have enough isolation centers that could do that, but now we have virtual isolation centers in all the states. We now have over 150 treatment diagnostic laboratories, and we have ones that are free in all the states, and the private ones serve the travelers and those who just want to have their test personally and want to pay for that. So looking at infection prevention and control, we did a lot in training and ensuring that all the standard precautions were done in our health facilities. That's improved, though we had healthcare workers that died due to COVID-19, but can imagine what it would have been if all these measures were not put there. Surveillance system to also, we were swift to respond. We had Nigeria Field Laboratory graduates and residents that were able to also support, which we deployed for rapid response teams. At a point in time in 2020, we had 52 rapid response teams deployed at a single time. It hasn't happened like that. So we were able to muster all these resources we had in the country to be able to get that done. So yes, as I said earlier, we still have room for improvement, but looking at the steps we took, even managing risk communications, communicating effectively to Nigerians, giving Nigerians daily figures of cases we had, being open with the data, those are the things that helped us, and we continue to build on those aspects. And by and large, I also like to thank other agencies of government, our colleagues in the Ministry of Health, Port Health Services, who were at our points of entry to ensure passengers were screened. So they really helped a lot, and all healthcare workers in our treatment centers, they did quite a lot to ensure that we are all safe, and some had to pay the supreme sacrifice, and we remember their lives today, and may God to grant them eternal rest. And we also really want to thank the doctor that really picked the first case which we had. If that wasn't picked, probably that the story wouldn't have been what we are talking about now. So it was a collective effort, and together is the way we can really move the nation forward to ensure that we are all safe. It's not just in the hands of healthcare professionals alone, but everyone. And we've seen that coalition of everybody coming up together, the private sector forming COVID. Those are benefits that we got from COVID-19, and we hope that that will help us to build our system to be more resilient for further public health events. Also noting that even within COVID, we responded to outbreaks of cholera, Lassa fever. By and large, I think we still have a lot to do, but we did quite well.
Talk about Bauchi State. Now, Dr. Rilwan, how did your state cope with surveillance and contact tracing for COVID-19?
Thank you very much. We really know that not everything is fine at the beginning. We have small teaching problem, particularly the laboratory. Initially, we have to send our samples to Abuja before our laboratory was approved, to molecular laboratories was approved. And then even as of today, we can only test and know we only have COVID-19. We can test and has the mutation, whether we have Delta, Omicron virus. So we can only test and know that we have COVID-19. That is one. That's a big challenge for the containment of the virus. In the country, I don't know whether Lagos and Abuja are the only state that are doing that. Now, we also had a problem with vaccine hesitancy from medical personnel, and then a lot of social media problem that came in to give us problem that the vaccine can cause infertility. A lot of fear that came into the mind of people because a lot of people are dying abroad while they were expected that will die will not. Then some people think that after 2 years we are going to die, and they saw us working. The first vaccine that came in, the first person that took it in Bauchi was His Excellency the Executive Governor, the Deputy Governor, all the traditional rulers, and the House Assembly members, all the people in the cabinet, and then all other people are taking it. Then later, the medical personnel agreed to take the vaccines because they saw that we are still alive after at least 6 months, 1 year. We are doing very well, better than them. Then we now have to create a social media platform to counteract vaccine hesitancy, because they are carrying, initially they carry spoon and put, and then they say that the spoon is holding, that there are problems. They also carry all sorts of a key. When making it, we now create a social platform. In our social platform, we have about almost 80,000 people now joining our platform. We are counteracting that issue. We are using motorized campaign in our marketplaces, in universities, in polytechnics to downsize. I'm telling you, with the the problem that we got, another problem that we got during this campaign is the issue of isolation. You want to isolate somebody, it becomes a real problem. We have to use security agencies to isolate people who are positive, families who are fighting us, and the security agency was also coming. People are fearing to come near COVID patients. A lot of problems, but by and large, we have done very well. I must give a pass mark to the country, particularly to the NCDC. Initially, I was fighting them, and I think they have done a little bit well now. And then even the MPSCDA for actually maintaining this vaccine. We are having enough vaccine in the state without a problem. The only thing is that people have started demanding for the vaccine. That's what we want. We are using social media platform to create demand. We are using our motorized borehole in all the market. We have finished about 4 local government. We are going to more. All the vaccine our hand is getting exhausted. They only brought J&J, Johnson & Johnson yesterday. 8,000 doses. We'll almost clear all our vaccines.
That's good.
And,
now, we'll go on a break right now. We still have more questions to ask. Stay with us.
This is NTA News 24 broadcasting from Abuja. You can watch us anywhere, anytime on the following platforms.
Start Times, Channel 101, Freak TV, Channel 703, GSTV, Channel 419, and Go TV, Channel 46.
For more information, log on to our website, www.nta.ng, or join us on our social media handles, Facebook at NTA News 24.
For comments, suggestions, and inquiries, send an email to news24@nta.gov.ng or call us on the following numbers.
NTA News 24.
News and more news.
Welcome back. You're on to Nigeria Today, and we're discussing 2 years of COVID-19 in Nigeria. Our guests are still here with us. Professor Nasidi, how would you say the coordination by the Presidential Steering Committee on COVID-19 helped to contain the pandemic in Nigeria?
Well, right from the word go, I kept saying it's a novel idea of bringing all, stakeholders together to, address on daily basis the pandemic that was threatening our people and that had actually started killing many people in many countries. And I think the fact that all ministries, all departments of government, private sector, were all put under that presidential steering committee, and now everybody will come to present what role they are playing. It's a novel idea brought up by Nigeria, and many countries copied what we did. I think it's a wonderful approach. But some of the issues that were raised, the key, and that is one of the banes of Nigerian governance issue, is the follow-up. Decisions are taken, no follow-up, and no effective follow-up, and some issues that should be taken, that how will I say, that should be immediate, or this will require some delays through poor coordination and all this. But these are faults that many countries experience, even countries that are much more developed than us. Then secondly, empowerment. The presidential steering committee really did some work that I think helped to reduce the impact of the virus or the disease on our people, and that is empowering the states. They did a lot in empowering the state. They got funds for states. They assisted the state governors and to brought them together, and we are very proud of some of them that did so well. Generally, the coordination of this response in Nigeria was quite effective. The role of the PSC was, really, something impressive.
Yes,
that
it was.
Many countries copied.
It was, yes, definitely. Now, Dr. Laolu, when the COVID-19 broke out, there were predictions of doomsday for Nigeria and, in fact, Africa. I remember some talk about the streets being littered with dead bodies. Now, that did not happen. Why did the predictions not come to pass?
Well, okay, that didn't happen. Yes, we are most of us didn't know what the virus was. It was a novel virus. So we are still learning about the characteristics. And we did the public health measures that needed to be taken, ensuring that we're able to detect on time, isolate, and do all the other measures, ensure that cases were treated. But one thing about the demographics of our country also helped. In Nigeria and Africa, we have a very young population, and what COVID-19 showed was that it was more deadly among those who are 60 years and above, and those who had comorbidities, hypertension, diabetes, and those were some of the things that really helped having a young population. But one thing about Nigeria and other African countries that really acted fast to be able to respond. We had more or less a coalition with Africa Centers for Disease Control leading that coalition for Africa, ensuring that we had the resources, ensuring trainings were done, testings were, laboratories were helped to be able to test for COVID, because when we had COVID in the continent, it was just South Africa and Senegal that could test, but we're able to really pull together as a continent and also as a region with the West African Health Organization. And with us as a country in Nigeria, we're able to also leverage on the outbreaks we've had in the past, lessons we've learned from the Ebola outbreak of 2014, first outbreaks we've been having in the country, trainings we've had on public health emergency operation centers, activating the incident management system, also ensuring that our logistics system was still working well. We were able to distribute personal protective equipment across the country, and the collaboration we've had even before COVID, the military coming, which the presidential task force really facilitated, even when there was lockdown, able to still move commodities to the states that needed it. So we acted as based on the science that we knew. We knew some things also worked well for us, being that we have a younger population in the country. So by and large, we did what we could do, and God was also on our side.
Professor Nasidi, in what ways would you say the pandemic helped to shape the economic or socio-economic life of Nigerians?
I think, if anything at all, it negatively affected the socio-economic aspect of our life, of our being. It affected lives and livelihood, and it took us by surprise. It knocked down our formal and informal economy, and it nevertheless prepared us to for worse situations. That is, it woke the government up.
Yes.
It exposed us to see that we are nowhere in terms of preparedness to fight diseases, to fight wars. We don't produce anything. We don't produce our vaccines. We don't produce most of the drugs we need to fight these diseases. We're importing everything. Almost 95% of what we need to fight the disease we're importing. So it sensitized the government to say, hey, listen, we are near and naked, and we need to wake up and start doing something.
Then we saw youths actually making face masks, hand sanitizers, and all of that.
Yeah, nevertheless, stimulated, that's our informal sector to become very creative, and started responding and started doing things that the hand sanitizers, the masks, so even some of Nigerian some geniuses, they created and even produced their own respiratory machines, and so on and so forth. And some of these machines were even used to save lives.
Okay, and, let me go to Dr. Riwan. Would you say the rural populace got as much sensitization on the pandemic as the urban populace? Briefly now.
Actually, what we really have advantage of the arrangement made by MPSCDA and the SCDC. The first phase of this campaign was actually medical personnel and strategic leaders, which was plugged up in Bochi with by the executive woman. The second phase of the vaccination particularly was for comorbidity patients, diabetes, hypertension, and other people. Then it was plugged up by the deputy governor himself. The third phase was actually for the community itself, everybody. It was flagged up by the Emir of Bauchi, Alhaji Suleiman Adam. And that has told the community that this vaccine cannot be toyed on, because the approval of this vaccination by WHO was for emergency use. So we're still working towards that. But people rejected using non-pharmaceutical method. The hand washing, face masks, and issue of social distancing were becoming trouble in churches, in mosques, in places of worship, in the mosque, everywhere. We have a lot of trouble in making social distances to work. But by and large, I don't know what happened after a lot of social media campaign by TV, radio, a lot of campaign by our local people around. I think a lot of things has been achieved. Now, let me tell you, last year, 7 people died of COVID-19. Last year, 2021. All of them are not vaccinated. All of them. The people that are not vaccinated are the ones who are getting the virus infected, and they die quickly, because the virus, let me inform the public, does not stop you from getting COVID-19, but it tends to reduce severity, like the measles vaccination. So I want to inform the public that we should be able to take these vaccines so that we get protected from this virus, so that our livelihood will be open. Some places like places of worship like Saudi Arabia, places of business like Dubai, were just open recently because they saw that we are working very hard by the NCDC, MPSCD. The steering committee was on their toes to make sure that things are work well in Nigeria. I think by and large, we must salute Mr. President and the media organization.
Thank you very much indeed. The long and short of it is that everybody should get vaccinated. Now we want to thank the former Director General, Center for Disease Control and member ministerial experts on COVID-19, Professor Abdul Salami Nasidi. Thank you for coming.
Thank you very much for having me.
Thank you, Dr. Rilwan Mohammed, Chairman, Bauchi State Primary Healthcare Development Agency, Chairman, Surveillance and Contact Tracing, Bauchi State COVID-19 Response. Thank you.
Thank you, NTA.
I also appreciate you, Dr. Olaolu Aderinola, Deputy Director and First Incident Manager of the National COVID-19 Emergency Operations Center, NCDC. Thank you for joining us.
Thank you so much.
Okay, and on this note, to conclude the conversation for today on Nigeria Today, we really appreciate our guests. Now, and to our viewers, we say thank you for being part of the program. Remember, you can still watch this episode and other ones on www.youtube.com/NTA News 24 Hub. Till I see you again tomorrow, I am Lydia Ochi. Good evening.